limit. Today's webinar will be presented by Concentra's National Medical Director of Medical Surveillance Services, Dr. Ronda McCarthy, and Concentra Director of Product Development, Melissa Hay-Boggs. At the conclusion of the presentation, we will have a 10 to 15-minute Q&A session with the presenters. You can submit your questions throughout the presentation to be answered during the Q&A. We will answer as many questions as possible within the time allowed. A recording of the webinar will be emailed to you after the presentation, so you can view it again at your convenience. Melissa, Dr. McCarthy, we're ready to begin.
Thank you. So, as she said, my name is Ronda McCarthy. I am Concentra's National Medical Director for Medical Surveillance Services. And I've been with Concentra for approximately 20 years. And for many of these years, I've consulted directly with employers on their occupational health programs, which include exposures to toxic and hazardous substances. I also chair Concentra's Regulatory Testing and Examination Medical Expert Panel. Melissa Hay-Boggs is Director of Product Development and is also a member of the Regulatory Expert Panel. When the updated silica final rule went into effect, together we created Concentra Silica Medical Evaluation Services to provide OSHA-compliant examinations and testing available to employees in all Concentra markets. Today, we will discuss the June 23rd General and Maritime Industries update to the silica standard and why it's occurring. We will also look at current research on silica exposure and how we can apply the findings, which leads us to why medical surveillance is vital and what you should expect from your occupational health provider. I will hand it over to Melissa to get us started. Thank you.
Hello. As Dr. McCarthy stated, we have been working together for quite some time, specifically around silica medical surveillance as well as many different exposures. We've had the opportunity to present a couple of different times throughout the years, but I'm sure not all of you have had the chance to listen in on those previous webinars. So before we get too deep into the content, we thought it would be a good idea to just kind of review exactly what is crystalline silica and why is it harmful to employees. So really I wanted to just kind of level set with everyone and define crystalline silica. It's a basic component of soil, sand, granite, and other minerals. Quartz is actually the most common form of silica. Several industries that typically work with this mineral include glass making, stone manufacturing or manufacturing with stone, creating china or ceramics. If you're working in a foundry, you might be exposed to silica, working with concrete. If you're in the mining industry, in construction, especially in working with artificial stone, and you can even find it in jewelry manufacturing. Some of our construction activities and even municipalities will experience silica exposure working with asphalt and pavement. Dental laboratories also will come in contact with silica. And finally, there are several household adhesives and abrasive materials that, when manufacturing, also produce the harmful crystalline silica. So in and of itself, crystalline or silica is not actually harmful. So if you're just handling it kind of in its natural state as one of those minerals that we just spoke about, it's not harmful to the employee. What happens is when you're working with that particular material and the material becomes respirable, that's when you start to worry about the effects on your employees. The amount of crystalline silica in natural stone actually varies quite widely. For example, in sandstone, you'll see 70 to 90%, and in granite, 30% crystalline silica, whereas lime and marble contain only 2%. So of note here, I want to make sure everyone understands that things like artificial stone actually contain as much as 93% crystalline silica. So when is crystalline silica harmful? it's harmful when it's made respirable, or essentially small enough to breathe deep into the lungs when it is used in things like high-impact processes, such as abrasive blasting, drilling, cutting, and sanding. It is in that respirable form that is actually covered by the OSHA standards regarding respirable crystalline silica. So the road to the silica standard has been quite a long one. It's not unusual. It can take 15 years or so to complete OSHA's rulemaking process. Initially, standards were set to limit workers' exposure to silica in 1971 when OSHA was created. The silica rulemaking process became a priority in 1990 when it was determined the standards were outdated and did not adequately protect workers from the health-related effects from silica. But not until 2016 did the updated silica standard finalize. The silica standard for both construction and general and maritime industry rules became effective over time. The graduated process occurs in order to make it economically feasible for companies to adjust over time. So requirements for engineering controls, those things that may call for actual investments in new tools, new equipment, machinery, and ventilation, for example, those cost quite a bit, and companies need opportunity to adjust to those costs and implement those controls. Hydraulic fracturing in oil and gas is not required to implement control to keep exposure below PEL because they're getting time to actually develop the controls for this new industry. So in these ways, it does take a lot of time to develop the standard and then allow companies to adopt and implement the controls that they need to have in place to protect their employees from exposure. Dr. McCarthy, do you want to talk through the specifics on what's tightening here in these controls and what the health effects are to employees?
Sure. And what's bringing us here together today is basically, as of yesterday, June 23rd, general and maritime industry employers are now required to offer medical surveillance exam at action level. The silica standard for general and maritime industry specifically has implemented this phased approach that you discussed, Melissa. In 2018, medical surveillance was required based on a higher permissible exposure limit for both general and construction industry. But as of yesterday, the standard invoked a more stringent action level requirement to offer medical surveillance. This is to employees specifically exposed or expected to be exposed at or above action level for 30 or more days per year. The goal of these medical evaluations performed at a reduced exposure level is early detection of silica-related illness and also to provide feedback on existing controls. Approximately 2.3 million workers are exposed to respirable crystalline silica or silica dust in the U.S. in construction and general industries. The silica standard limits the amount of silica exposure that employees can be exposed to at the workplace and provides regulation on how best to attain these limits to employers. The overarching purpose of the regulations are to prevent serious disease and death. Although it is well known that workers suffer health effects from it's been well known for many years that workers suffer health effects from long-term exposure at lower concentrations of silica, but there's also an equivalent short duration exposure to high concentration of silica can have 3 times the health effect or the damaging health effect on workers. So work that has high concentration exposure, such as abrasive blasting and artificial stone fabrication, have now been noted to have effects that we are going to talk about today. So what are the health effects of silica exposure? Silicosis basically is an incurable lung disease that is caused by inhaling these respirable particles of crystalline silica. These particles trigger inflammation and scarring in the lungs, leading to a progressive, irreversible, and potentially disabling disease. Silica exposure also is associated with increased risk for lung infection, most notably tuberculosis, lung cancer, obstructive pulmonary disease such as COPD, autoimmune disorders, and kidney disease. Let's cover the current research on silicosis and other silica-related disease and what we can take away from these findings, such as the high exposures that that workers have been exposed to with some of these newer industries. So some of the recent changes in the past few years that may have contributed to this new information on silica exposure is the medical screening for specific worker populations that OSHA has mandated since 2017, and the engineered or artificial stone and hydraulic fracturing industries that are newer for the United States and are expanding quickly due to the increased demand. Research published actually last week in the journal Chest, the lead investigator reported that on a cohort of workers, or a group of workers from the fabricating engineered stone fabricating industry, these workers fabricated and installed quartz countertops. Most of the silico cases were referred from the workers after they were referred to specialists and had more advanced disease. Of great significance, all these patients had already been removed from continued exposure. 1/3 of the patients initially had simple silicosis, and after removal, on the average of a 4-year follow-up, had advanced to progressive massive fibrosis. So it's a severe debilitating silicosis. And workers who were removed from exposure due to abnormal breathing studies in approximately the same average 4-year follow-up, their breathing studies had worsened, or had like a double, these persons had a like almost a twice worse effect in their breathing abnormalities. These high rates of progression are in contrast to the lower percentages of disease progression seen in miners and granite workers from the past, where in one study there was only a 10% progression to the severe lung disease over a 22-year period. So here you have in these new industries workers who have pretty significant disease, and then even after a 4-year follow-up have even more severe disease, so in a very short period of time. So the author states that aggressive medical surveillance should be instituted for this workforce. Another research report, the Morbidity, Mortality, and Weekly Report, also reported on severe silicosis in engineered stone fabrication workers from 4 states. I'm actually an author on this report, as I evaluated and diagnosed the Texas cases. This report also highlights that silicosis is generally considered this report also highlights that younger workers were found with serious lung disease. The disease developed early, and the affected employees had 2 to 30 years of exposure. The affected employees were found to be in their 30s to 50s, and previously in the engineered stone fabrication workers, only 1 U.S. case was reported prior to this report in the late 2019. So not only did they suffer from silicosis in this report of 18 cases from 4 states, they also had autoimmune disorders and tuberculosis. 1 case had tuberculosis. One of the deaths was actually from an autoimmune disorder, but was also diagnosed with silicosis. So the issue is that artificial stone popularity is growing rapidly and that this problem needs to be addressed. And this is just kind of giving us an example of the severe health-related effects that silicosis causes, but in a sped-up fashion because of the high exposure. Well, it was also found that, unfortunately, most of the reported cases of artificial stone-associated silicosis were not detected by medical surveillance in these at-risk population. Rather, they were workers who were referred to specialists and transplant centers that presented with advanced diseases. Employees are hesitant to report illness and do not necessarily seek medical attention until their disease is severe. Some of the reasons we are seeing low levels of reporting are the lack of employment opportunities in these workers, diminished access to healthcare, and general fear of retaliation on the side of the employer. I myself have evaluated silica-exposed workers who do not want to report disease over the past several years. These workers are more concerned about providing for their family than their health. But now, with increased awareness of the dangers of silica, it is wise for employers to aggressively approach control measures and medical screening to prevent this costly illness and injury in the workplace. Exposure monitoring must be done and those values heeded. Education and training are essential for supervisors and workers. Proper use of controls and respirators should be required. For example, wet sweeping may be available at a work site, but it doesn't decrease the exposure if the employees aren't using it, because it saves time for them to use the older methods. Or a tight-fitting respirator will not work as intended if the employee has a full beard, which I've seen many, many times. Training on silicosis will also help employees understand the health effects and when to report symptoms, or actually just the importance of the screening that's offered, because most people do not have symptoms when they're affected by silica-related health effects until the disease is severe, and making it more costly for the employers with work illness and workers' compensation costs. So why is medical surveillance so vital? Exactly for the reasons stated. And that silicosis is entirely preventable. Use the hazard controls that are outlined in the OSHA standards. You can even go above and beyond. It calls for exposure monitoring, outlined exposure controls, and medical surveillance. The medical surveillance for baseline screening is to assess the health of the worker prior to silica dust exposure. You do not want to put someone who has underlying health condition that may make them more sensitive to the health effects of respirable crystalline silica. Also, the screening helps detect early health effects, so you can discuss with that employee how to best manage the health effects before it becomes a disabling disease. They can have restrictions, have better PPE, or asked to be removed to a different area of the plant or different work entirely, so they can maintain their health. Provide respirator restrictions. Some employees may be exposed at a level where it doesn't require a respirator. Some may not be able to use their respirator adequately and need alternatives. The medical surveillance also is a feedback mechanism to provide the employer information on the effectiveness of existing controls. So if you have groups of employees that are coming up with health effects, that lets you know that your engineering and administrative controls need to be addressed and changed. So the National Institute of Occupational Health and Safety defines the rungs of protection for all hazardous exposures in the hierarchy of controls. So we know that where you go from the most effective to the least effective down on the bottom of the triangle here. So elimination of the hazard would be the best control. Substituting to a less hazardous substance would be the next. Where we spend most of our time here for the silica, OSHA silica standards is in engineering and administrative. And PPE, the respirator, is the least effective. The medical surveillance and medical screening helps back up the engineering, administrative, and work site controls, and can actually act as primary prevention when used as a feedback mechanism, as we discussed. The specifics on the exam for the medical surveillance, this may just be a review for some and maybe new for others if you are now having to provide medical surveillance exams now that the ruling has gone down to action level. Baseline and the periodic exam are very similar. You have a medical and occupational history and physical exam focused on the respiratory and immune system, and then you also have spirometry that must be administered by a technician who is certified by a non-OSHA approved spirometry course that is part of the standard. A chest X-ray, one view with a specialist overread that helps look for changes related to silica exposure, pneumoconiosis specifically, and then also tuberculosis screening at baseline. The periodic exam does not have the tuberculosis screening. There are also recommended tests that can be added. So the OSHA requirements are the minimum requirements for general and construction industry, but there can be additional testing either based on the employee's history and exam and testing that the clinician may advise, or that the employer would like to add just for more thorough screening, such as kidney function testing, since the kidneys can be affected, and additional tuberculosis screening, since there is an increased risk, especially after years of exposure. Respirator medical clearance is a separate medical evaluation that is covered under the respirator protection standard, but you can add that to the silica medical evaluation as they have overlapping examination components. By performing both of these at the same time, the employer can reduce employees' time away from work and reduce overall cost of these services. It may be that the employer wants to perform the respirator medical evaluation or clearance exam prior to the silica medical surveillance to make sure the employee is fit for wearing a respirator prior to putting them into to a silica exposed job, to ensure that they are able to wear that respirator if that's part of the requirement. So that's an alternative way to proceed as well. But I'd like to also just advise that it's important to make sure that the respirators fit well. And I've often seen when touring plants that many employees don't actually do, even with the training and the fit testing, may not perform their seal check, may actually have facial hair that's interfering with the seal. And it's important to inspect the respirators regularly and replace them when damaged. And also, OSHA requires the fit test annually. So if the respirator is not sealing correctly or is damaged, it's not doing the work that it was meant to do and could be causing additional exposure to that employee. Additional requirements of the silica standard after the examination is that there are written reports to the employer and the employee. There's actually 3 forms that are required to complete after the silica medical screening exam: the employer written medical opinion, the employee written statement, and the authorization of the employee to provide an opinion to the employer. So the employer written medical opinion is the information on this opinion is limited to the date of the exam, if the standard was met, the medical evaluation that was required by the standard, and if there are any respirator restrictions. Concentra systems automatically prints out all these OSHA compliant forms that are provided to both the employer and the employee. A written medical opinion for respirator use, if requested, is also provided, and this differs from the silica written medical opinion. The authorization for crystalline silica opinion to the employer provides additional information if the employee consents. And this is limited to exposure, whether there will be limitations on the employee's exposure to silica, and whether the employee consents to a referral to a specialist, if applicable. The standard requires a referral to a board-certified pulmonary specialist or occupational medicine specialist if there are specific findings on the B read of the chest X-ray. But the employee can decide not to choose those options and make their own health decisions. And then the employer is not responsible for that if they choose not to sign that authorization form. Melissa, these reports are then sent to their employer once completed, and they should be received in 30 days after the evaluation. And we have a process for that as well. Are there any other thoughts that the employer should consider?
Yes, there are. I want to cover a couple of things that you can expect from Concentra, but also things that you should be looking for from any occupational health provider to make sure that you're getting quality services regarding medical surveillance. So one of the things that you want to make sure is that your health provider can advise you specifically on, the federal or state-specific regulations around OSHA requirements. You want somebody who is educated and attuned to any changes to make sure that you're going to be in compliance should you ever get audited. So you want to make sure that they're aware of the federal and state laws, that they know exactly what components are required. And in the case of silica, the kinds of technicians who have to have specialized training to be able to perform some of the tests that are involved in the exam. Another thing that you should be looking for are clinicians who understand the intersection between workplace health and the regulations and the employer's challenges fulfilling all the requirements. Our regulatory testing and exams medical expert panel is consistently, reviewing the rules and making sure that our clinical guidelines are exactly what they need to be and, meet the requirements, but aren't, going to be going beyond the testing that is actually required. We do make recommendations based on the health effects of what different exposures can cause with employees, just so that you have the opportunity to review those additional tests and potentially get in front of issues that can develop over time. But we're not going to just do a full suite of tests that aren't specifically required or related to some of the regulations without consent from the employer. So looking for an occupational health provider that can pay attention to those things and keep the best interests of the employee and the company in mind. That's where some of the expertise comes in and really understanding what occupational health is and applying healthcare specific to what's happening with that person at the place of their employment. In this way, you can expect to receive or to obtain kind of reduced direct costs and indirect costs. In the case that I want to just make an example of is how Dr. McCarthy is saying, if because there are overlapping components between respirator clearance and silica medical surveillance, the thought of combining those two services in a single exam helps cut out repeated tests and make sure that you only have to send your employee in, one time versus 2 times. We know that all of those things matter specifically to our customers. So those are some of the things that you really should be expecting from your occupational health provider, in addition to, the specifics around silica with the written medical opinion reporting, the specific documents being OSHA, in compliance with OSHA regulations, and the communication of those written medical opinions to you as the employer so that you can make sure you have the record and the information necessary to maintain your program at your place of work. So at this time, we have covered quite a bit. I'd like to turn it over to Anna to facilitate some Q&A.